And now shall we proceed with the next session provided by Dr. Fathia El Sharkawi, and the session chair will be Dr. Sameh Sroor, who will present Dr. Fathia. Welcome, Dr. Sameh, you can go.
Good morning, everybody, for this third lecture in our morning session in the second day of the fourth International Pharma Conference. Now we are going to switch a little bit from the pure hard science and pharmaceutical research to, I think, one more light topic. Dr. Fathia El Sharkawi is going to talk to us today about the keto diet benefits and risks, and I think this will be of interest from the scientific point of view as well as personal interest of many of the attendees of the conference. Dr. Fathia El Sharkawi is Professor Emeritus at the Department of Biochemistry and Molecular Biology, Faculty of Pharmacy, Helwan University, and Dr. Fathia has been the Dean of Community Service and Environmental Development at Faculty of Pharmacy in Cairo University. And she has a lot of publication in different areas of the molecular biology and clinical biochemistry. And she's also a reviewer in many of organizations like STDF and STIFA, right, what's called now STIFA, and the Cairo Scientific Research and Technology. So please, Dr. Fathia, floor is yours.
Thank you, Dr. Sabah, for this nice presentation. Good morning, everybody. It's my pleasure to join this fourth International Pharma Conference in Helwan, Faculty of Pharmacy, Helwan University. Also, I'm so happy that I will share with you a critical topic which is spread in the last years or in the few years among youth and adults and everybody, which is the keto diet. Here I will talk from the biochemical and the medical view. Since I am not a nutritionist, I am a biochemist. So I will deal this presentation from the biochemical and medical view. First, I would like to tell you about the topics which will be presented. We will discuss what is the keto diet, what is the keto diet, and mechanism of its action, and then the therapeutic uses of this keto diet in weight loss, cancer therapy, aging, and lipid profile, diabetes mellitus, and in COVID-19. And then we will discuss the risks of keto diet, and finally, I will share, I will hear from you about your opinion if this keto diet is safe or dangerous. Keto diet was firstly used as a treatment in the treatment of epilepsy in 1921, before any drug of epilepsy has been discovered. What is the ketogenic diet? The ketogenic diet is a high-fat, moderate carbohydrate, moderate proteins, and very low carbohydrates. It contains about 60% fat, 35% proteins, and about 5 to 10% carbohydrates. The idea behind this type of diet is to force the body into the ketotic metabolic state. What is the ketotic metabolic state? Following carbohydrate deprivation or very low amount of carbohydrates and the depletion of glycogen stores, the body undergo metabolic changes to provide the energy source for the body through gluconeogenesis and ketogenesis. Gluconeogenesis may be sustained for 3 days when the person is adhered to a ketogenic diet. So additionally, energy sources are necessary to meet the metabolic requirements of the body and brain. This is why the process of ketogenesis becomes indispensable, and the formation of ketone bodies is then used as a primary energy source by cells in mitochondria and in the brain, especially in the brain. As we said, glycogen stores deplete, forcing the body to go through a certain metabolic changes. Two metabolic processes come into action when there is low carbohydrate, there is low or very low carbohydrate availability in body tissue, gluconeogenesis and ketogenesis. Formation of ketone bodies. After 3 to 4 days of fasting or very low carbohydrate diet, which is a ketogenic diet, the CNS needs an alternative energy source, and this is derived from overproduction of acetyl-CoA, which is then produce the so-called ketone bodies. There are 3 names or 3 types of ketone bodies. The most famous is the beta-hydroxybutyric acid, which is involved in the next mechanisms. This process is called ketogenesis and occurs in the mitochondrial matrix of the liver. What does the keto diet do? What is the mechanism of the keto diet? The keto diet do what's called nutritional ketosis. What is nutritional ketosis and what is the difference between nutritional ketosis and ketoacidosis? During ketogenesis, due to low blood glucose feedback, stimulus for insulin secretion is also low, reduces the stimulus for fat and glucose storage. And there is other hormonal change may contribute to the increased breakdown of fats that result in fatty acids. In the keto diet, fatty acids are metabolized to acetoacetate and beta-hydroxybutyrate, and this metabolic state is referred as nutritional ketosis or physiological ketosis. The nutritional ketosis is considered as quite safe because it is not change in the pH of the blood. But ketoacidosis will cause change in the blood pH. Here, when we compare the normal diet and the ketogenic diet and the diabetic ketoacidosis, we will notice that the level of blood glucose will be higher in diabetic ketoacidosis than ketogenic diet. The insulin level will be decreased than the normal diet. And also the ketone body concentration will be very high in diabetic ketoacidosis, which is considered as a disease rather than nutritional ketosis. The pH of the blood stable in normal diet and the ketogenic diet, but changed in the diabetic ketoacidosis. This is the pyramid, food pyramid of keto diet, which is different from the normal food pyramid. We notice that fats compose about 75%, and then proteins about 20%, and in the top of the pyramid, we see the carbohydrates, which is about 5%. What are the therapeutic uses of keto diet? Keto diet can be used for control of diabetes, for treatment of epilepsy, as we said before. Keto diet is efficient in weight loss and weight reduction, and to maintain the cardiovascular risk parameters. We will discuss in details these uses or these factors and what is the keto diet do for every one of these. First, we will talk about ketogenic diet and weight loss. Here, a study done on 12 weeks keto diet showed that there is a significant effect on body weight and physical performance, eating behavior, the metabolic and hormonal profile in obese adults. 12-week keto diet results in decreased appetite, results in weight loss of participant, decrease emotional and external eating, increase the body image, and improve the physical performance of all participants. Biochemically, there is a transient negative period or a negative effects of transient periods where there is a negative effect of the keto diet at weeks 1 and 2. Since the body has not adapted for the new stage or new nutritional or new ketosis state. After adaptation, all parameters returned to baseline. Parameters included the blood glucose level, included a C-reactive protein, including some hormones, including high-density lipoprotein or low-density lipoprotein cholesterol. In the first 2 weeks, there is a disturbance of these parameters. Then, after 8 to 12 weeks, the positive effect of keto diet with evidence in weight loss and the metabolic profile. So, the keto diet should last at least 8 weeks to observe any improvement in health status in both men and women. But the role of long-term keto diet, which is deficient in all researches or all studies, needs to be further studied before general recommendation can be made. Unfortunately, most of the studies was done on a short period, but there is a little information about the effect of this keto diet on long term or long times. What is the mechanism which is the keto diet do in weight loss? There is no doubt that there is a strong supportive evidence that the use of ketogenic diet in weight loss therapy is effective. However, there are some contrasting theories regarding the mechanism through which they work. Some researchers said that there is no, or there are not, in fact, any metabolic advantage in low carbohydrate diet. And that weight loss results simply from a reduced caloric intake due to increased the feeding of protein. And other researchers reported that the weight loss of ketogenic diet seems to be caused by several factors. One, reduction in appetite due to higher feeding or saturation effect of protein, which affect the appetite control hormones, and to a possible direct appetite suppression action of ketone bots. Second, reduction in lipogenesis and increased lipolysis. Third, reduction in resting respiratory rate and therefore greater metabolic efficiency in consuming fats. What about the keto diet and the lipid profile? In keto diet and lipid profile, or the effect of keto diet on the atherogenic factors, there are many debates regarding this issue. Some researchers may support the use of ketogenic diet in regulating the lipid profile parameters, and other researchers have a contrast theories or contrast studies about the effect of ketogenic diet on the atherogenic parameters. So we will introduce the two opinions or the two studies. The reduction of carbohydrates to levels that induced physiological ketosis can be lead to significant benefits in blood lipid profile. Keto diet effect seems to be marked on the level of blood triglycerides. It causes decrease in the blood triglycerides and in total cholesterol reduction and in increasing the high density lipoprotein cholesterol, which is a safe parameter for atherosclerosis. On the other hand, the keto diet cause increase in the size and the volume of low density lipoprotein, which consider to reduce vascular disease risk, as smaller low density lipoprotein particles have a higher atherogenic effect. The mechanism that the authors depending on is the key enzyme which is responsible for the synthesis of cholesterol, which is the hydroxymethylgluteryl-CoA reductase. Hydroxymethylgluteryl-CoA reductase, which is the key enzyme in cholesterol synthesis, will be activated by insulin. And since the level of insulin is decreased in the keto diet, so this enzyme will be inactivated or decreased, which lead to increased endogenous decrease in the endogenous cholesterol synthesis. Here I will present the risks or the other theory which deal with the effect of keto diet on the atherogenic parameters later in the risks of the keto diet. But here in the therapeutic uses, some researchers suggest that keto diet is good for normalize or for regulating the triglycerides and the total cholesterol and high density cholesterol lipoprotein, density lipoprotein cholesterol. the third or the yes, weight loss, lipid profile, epilepsy, or the fourth of uses of ketogenic diet is in cancer therapy. Keto diet can be used as adjuvant in combination with the chemotherapeutic drugs. What is the mechanism of keto diet in cancer therapy? Cancer cells utilize glycolysis in the production of ATP. And some cancers lack the ability to metabolize ketone bodies due to lack of enzymes or due to down regulation of enzyme necessary for ketone utilization. So the rationale in providing fat-rich, low-carbohydrate diet in cancer therapy is to reduce the circulating glucose level and induce ketosis, such that cancer cells are starved of energy, while normal cells adapt their metabolism to use ketone bodies and survive. Furthermore, by reducing blood glucose levels of insulin and insulin-like growth factor, which are important drivers for cancer cell proliferation, drop. There are some types of cancers which the keto diet is effective in this type of cancer, in addition to the chemotherapeutic drug, like pancreatic, lung cancer, breasts, stomach, liver, colon cancer, prostate, some, and so on. Keto diet and aging. In a study done by Roberts et al., reported that lifespan is increased in aged mice consuming a keto diet compared to standard control diets. And this due to that keto diet increased the protein acetylation level and regulated the mTOR C1 signaling pathway. Keto diet and atherogenic dyslipidemia. Adults with atherogenic dyslipidemia who were keto diet for 12 weeks has favorable improvement in circulating free fatty acids and reduction in markers of vascular inflammation. This amelioration in vascular inflammation has been shown to be mediated by beta-hydroxybutyrate, which inhibit the expression of the NLRP3 inflammasome, which is responsible for the inflammation. Keto diet and diabetes mellitus. It was reported that keto diet regulates the blood glucose level in type 1 and type 2 diabetes. Benefits of following the keto diet to patients with diabetes include decreased glycemia, lower levels of fasting insulin, decreased insulin resistance, and potentiating decreased requirement for insulin or oral glycemic medication. But keto diet should be used with the anti-diabetic medications. Keto diet and elderly COVID-19 patients. This study is done in 2020, September, by researchers at USA, which reported that ketogenic diet is capable of mitigating clinical outcomes of COVID-19 in elderly people by improving immune metabolic functions and reducing inflammation, which caused by this virus. Since aging-induced chronic inflammation is predominantly driven by the NLRP3 inflammasome, which is a myeloid cell expressed multi-protein complex, a myeloid cell expressed multi-protein complex associated with molecular pattern and the danger associated molecular pattern to cause the process and secretion of some interleukins, such as interleukin 1p and interleukin 18. Also, there is increase that SARS-CoV-2 infection, which is similar to COVID-19, activates this inflammasome with increased level of interleukin 18 and lactate dehydrogenase level due to inflammasome-mediated pyroptic cell death. So keto diet, since it will inhibit this inflammasome, so it is effective in ameliorating the inflammation effects caused by COVID-19. It is now known that increased glycolysis, which activates the inflammasome, is associated with worsened COVID-19 outcome. In the opposite side, ketone metabolites protect against disease through inhibition of this inflammasome. Now we will shift to the risks of the keto diet. The first risk is the keto flu. Common short side effects resulting from initiation of keto diet as a body depletes its carbohydrate stores and switches to using ketones and the fat for fuel at the start of this eating. You may experience flu-like symptoms, which includes fatigue, headache, dizziness, nausea, vomiting, constipation, and low exercise tolerance. These symptoms typically resolve after a few days to weeks as the body adjusts to this type of diet. Now we will come to the cardiovascular risk theory. The scientists or researchers, depending on that keto diet will be danger for the cardiovascular parameters, reported that there is lack of evidence regarding long-term studies on the cardiovascular implications. So this making recommendations against or in favor of keto diet should be a topic of further discussion. Keto diet may be associated with some improvements in some cardiovascular risk factors, such as obesity, type 2 diabetes, high density lipoprotein cholesterol level, but these effects are usually limited in time. More studies are wanted to better assess the effects of long-term use of keto diet on metabolic disease and the cardiovascular risk factors. There was a study done in children at 6-month keto diet, and the results of this study showed a significant increase in the atherogenic ApoB lipoprotein and a decrease in the anti-atherogenic high-density lipoprotein cholesterol. Renal carcinoma. In contrast to the safe application of keto diets, it is reported that mice bearing renal cell carcinoma, xenografts, and with signs of Staffer's syndrome experienced dramatic weight loss and liver dysfunction when treated with keto diet. The study also demonstrated that the ketone body stimulates the oncogenic signaling of the PRAFA pathway. Keto diet may stress your kidney since it is high in protein, and the protein will produce high levels of nitrogen excretion, which can increase glomerular pressure and hyperfiltration. Kidney stones. High intake of animal foods can cause more acidity of the blood and urine, leading to increase the excretion of calcium in urine and reduce the amount of citrate, which leading to the development of kidney stones. Also, there is an increase in the uric acid formation in the body, which is a major factor for the uric acid stones. Changes in gut bacteria. Due to its carbohydrate restriction and also fiber restriction, the keto diet is often low in fiber, and this may trigger constipation and negative effect on gut bacteria, leading to constipation and decreased immunity. There are some keto-friendly foods that are high in fiber, including flax seeds, chia seeds, coconut, broccoli, cauliflower, and leafy green. Low blood glucose. If the patient with diabetes does not adjust the insulin treatment and they are taking too much insulin, they will suffer from very low blood glucose, especially when they are in keto diet. Damage bone health. Keto diet may reduce your bone mineral density and trigger bone breakdown over time. Several studies in animals link to the keto diet to decrease the bone strength due to loss in bone mineral density, which may occur as your body adapts to ketosis. Increase your risk of chronic disease and early death. Some evidence suggests that low carbohydrate diets that focus on animal foods may lead to higher death rates from heart disease, cancer, and other causes. Nutrient deficiency. Keto diet provides insufficient vitamins and minerals, including potassium and magnesium. So, long time use of this keto diet will result in nutrient deficiency. Conclusion. We can conclude from these studies that keto diet is limited and contraindicated in patients with liver failure, pancreatitis, inborn disorder of fat metabolism, primary carnitine deficiency, and some other diseases. The limitation of most studies are attributed to small size من volunteers or patients, short duration of intervention, and the high participant dropout rates. Participants ما بيكملوش. Even so, some studies show positive results. We cannot consider them applicable to the general population, especially given that patients with diabetes or obesity have other conditions such as dyslipidemia and the cardiovascular disease. Patients diagnosed with diabetes or insulin or oral hypoglycemic agents may suffer severe hypoglycemia, as we mentioned before, if their medication regimen is not properly managed during initiation of keto diet. Long-term side effects including hepatic steatosis, kidney stones, hypoproteinemia, and vitamin deficiency may be a result. The sustainability of the diet has been called into question, and the prognosis of the diet's effects after discontinuation must be examined. Finally, it should be mentioned that it is difficult to know in studies if low carbohydrate diet were real keto diet or not, because there is no measurement of the concentration of the ketone bodies in the blood. Most of the time, there is no report about potential induction of ketosis by, for example, reporting measurements of plasma ketone bodies. Plant-based diets allowing a daily moderate content of non-saturated fats, small amounts of red meat, and saturated fats are safer, associated with reduction in several chronic disease, including atherogenic cardiovascular disease. Finally, I would like to thank you for your attention, and I hope that you share with me your opinion about the keto diet. Is it safe or not? You can contact me via email because I need to know your opinion about the safety of ketogenic diet. Thank you so much.